Corrective care chiropractic adjustments for forward head posture and hunched forward posture. That's what this video is about. If you have a forward head posture or a hunched forward posture, basically means something like this, including the rounded shoulders. Then in this video, I'm going to show you how we apply corrective chiropractic techniques and corrective chiropractic adjustments. I'll actually show you 4 of them to fix forward head posture and hunched forward posture. So why is forward head posture and hunched forward posture even a problem? Well, besides the aesthetics and the looks of it, most people don't like that they look like this, right? On top of all that, the aesthetics, it actually has some serious health consequences, and it can relate to conditions like neck pain, headaches, upper back pain, tightness in the neck and upper shoulder muscles. It can lead to degeneration of the cervical spine, irritation on the nerves that come from the neck into your arms and fingers, numbness and tingling. A lot of different clinical presentations can be related to a forward head posture and a hunched forward posture. Hey there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift easier without pain and limitation. And I also introduce you to corrective chiropractic techniques like in this video here. So if you want more of these strategies and you want to learn more about corrective chiropractic techniques, do subscribe right now. Like this, you don't miss out on my weekly video updates. So the overarching strategy to correct spinal alignment problems and postural problems like forward head posture and hunched forward posture is what's called mirror image adjustments or postural or alignment correcting adjustments. And the word mirror image comes from CBP or Chiropractic BioPhysics, which is a coined term by the Chiropractic BioPhysics group. I'm a certified chiropractic biophysics doc, and what that means is that when you correct global spinal alignments and postural alignments, you want to put the patient in the mirror opposite position and then adjust the spine and trigger the proprioceptors and mechanical receptors to re-educate that new position, whether it's a postural adjustment or a spinal adjustment. So again, what that means is this. I'll give you an example. So let's say that this is the presentation, right? Forward head posture. Well, the mirror image of that, right, is opposite. So in the opposite position is how we're going to stimulate the spinal structures and the proprioceptors and mechanical receptors through manual adjustments, table adjustments, or instrument adjustments, and then re-educate the spine and tissues to retain the position. Now, I'll never retain the overcorrected position, but if you're here and you train it to come back like that, it'll find that happy middle spot, which is more ideal, closer to normal. So let's get into the demonstrations. I'm going to show you 4 corrective care techniques to help fix forward head posture and hunched forward posture. Let's get started. So I have my assistant here, Sahej, who's going to help me demonstrate these adjustments. So let's say the patient comes in with a forward head posture, hunched forward posture. We're going to work with some mirror image corrections using an instrument adjuster. And this is called an impulse adjusting tool. Creates taps like that, very gentle, and we're going to use that to stimulate the proprioceptors and mechanical receptors in high concentration areas, which is the shoulder and also the upper neck region. Before we do that, we're going to place the patient into a mirror image position. So let's show the bad position. So go forward. Okay, so bad position, rounded shoulders, right? So forward head posture, rounded shoulders, beginning to hunch up here. This correction is a mirror image correction for that forward head posture or that forward head translation and rounded shoulders. Open up the shoulders, palms out. Bring the head back as far as you can. Hold back, 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 back. Help the patient. Shoulders open as far as you can. And then I'll use my instrument and tap some of those high concentration mechanical receptors. Okay, I can do the opposite shoulder. Reset the patient. Go back as far as you can. Chin down. Okay, and then tap the neck area. Pull the head back as far as you can. Keep pulling, keep pulling. Keep pulling, keep pulling. And help the patient through that position. Keep pulling back as far as you can. Hold back, hold back. I can do that several times. So that's adjustment number 1. It's in the standing position. We use a block here to support the patient. Bring the patient back into the mirror image position and open up those shoulders. And then the whole idea with all these adjustments is to tap and and stimulate those mechanical receptors to send quick information to the brain, and the brain sends quick information back to the postural muscles to retain that new position. Now, we'll never retain the overcorrected position, but somewhere down the middle, it'll begin to do that. And then over the course of several weeks of corrective care treatment, we take before and after pictures, before and after x-rays, and we see these corrective changes in the after images as an outcome of our care. Okay, so now the next type of corrective care adjustment we can do for a forward head posture and a hunched forward posture is this one here, which is going to work more on that hunched forward posture. If someone has a hyperkyphosis or swaying back or even translating back with their rib cage, it'll look like this. So go ahead and go to that slouch position, slouch even more. Okay, so head's forward, shoulders are rounded, and the back is rounded here. So I'm going to get a block, just like this, a yoga block, put it behind, so come forward. So now that's the patient's presentation, right? So what we're going to do is we're going to bring the hips back a bit. You might not see it on the camera, but the hips are going back. Open up the shoulders. So we're going to reduce that hunched forward posture. Bring the head back as far as possible, okay? And hold there for a moment, okay? And then again, we stimulate those joints. Push the glutes back. It's a little more difficult. Head back as far as you can. Chin down. Pull your chin down. Down, yeah. Keep pulling back. Hold back. Okay, so now that's more targeting that hunched upper back, mid back area, rounded shoulders in combination with the head position. So combination of hunched forward posture and combination of forward head posture correction. Okay, so adjustment number 3 is going to target the rounded shoulder component of a forward head posture and hunched forward posture, and as well may even help that hunched part of the thoracic spine as well. But we have the patient in a supine position on our chiropractic table. This is a specialized table with drop pieces. You're going to hear some clunking noises. That means the drop pieces are just dropping down about half a centimeter or so. And in doing so, again, we're going to stretch out the shoulders. So let me show me around the shoulders. So you see the shoulders are rounded as the presentation is here. The person's head would normally be somewhere up here in the presentation. So it's coming back down on the table. So it's being pulled back behind the shoulders somewhat. And the idea for this one is mostly a shoulder adjustment. So open up those shoulders, open up, open up, open up, good. You're gonna bring the table up, okay, palms up, facing up, okay? And we're gonna open up the shoulders, pull them back into the table, and I'm gonna thrust down, just like that. It's a nice stretch into the pectoralis muscle and a lot of good proprioceptive input, mechanical receptor input into the brain to help correct that forward head posture, that slouch forward posture, and that rounded shoulder posture as well. Do that several times. It's actually very gentle on the patient, and the people that have this actual presentation with hunched forward posture and rounded shoulders posture actually really like this adjustment. Now, the fourth corrective care adjustment is going to target specifically that forward head posture. We can also do it with the table. You saw the standing version earlier. Now this is the table drop technique version, patient's prone. Okay, now in this presentation, this is not the way we want to set up the patient. They're not in the mirror image position. So the head is slightly forward compared to the shoulder, so we need to put it into the mirror opposite position. So I use this specialized table, has an elevation piece here, and I can bring it up really high. Watch the head go nice and high. Okay, so now ear is past the shoulder, tuck the chin in a little bit, okay? I can go even higher. So now the head is in the mirror opposite position from that forward head position, and I'm not going to thrust on the neck or head. We're going to thrust over here in the thoracic region, and again get a lot of input into the brain and nervous system to retrain this, okay? And if they have that slouch posture too, adjusting to the thoracic region is also very useful for that. Get the table ready, and we're going to drop into that. Just like that. Very gentle. Do several times. And then bring that back for the patient's comfort. And that's how we adjust for a forward head position, forward head posture in the mirror image position using a drop table. So there you have it. There's 4 great techniques that we use pretty much on a daily basis with our patients. We've helped improve the posture and alignment of many patients with forward head posture and hunched forward posture. And if you're looking for this type of chiropractic care, I can help you possibly. This is called Corrective Chiropractic Care. If you're looking for a corrective care chiropractor, just comment below in the comment section and I'll send you an actual directory of CBP trained and certified docs like myself, and hopefully you can find someone in your area. There's many in the United States, many across Canada, and even across other parts of the world. So hopefully you can find one in that directory. As well, if you're looking for the actual types of exercises that can help with neck hump and forehead posture and also hunched forward posture, go to this video right here. It's another one of my videos that shows some of the corresponding mirror image postural corrective exercises for this type of postural presentation. So right here to watch that video right now.